You're welcome back. This is Newsfile, it's your most authoritative news analysis platform. I'm your host, Samson Ladi Anyanini. And my guest in the studio, Osei Mensah Bonsu, the Honorable MP for Swami, former Majority Leader and Minister of Parliamentary Affairs, and now Leader of the Majority Group in Parliament. Mahama Ayarga is the Honorable MP for Boku Central and former Minister for Youth and Sports. Joining us via Zoom and via phone to do this discussion will include Samuel Intim Dakwa. He is former clerk of Parliament, worked in all four republics, and he likes us to say that he's an Adisco old boy. On Zoom, Kofi Bento, lawyer and senior vice president, Timani Africa. Martin Pebu is a rights activist, is a lawyer. Dr. Titus Bayo, Deputy General Secretary and member, Infectious Diseases Committee, Ghana Medical Association, and Kwame Sapong, a CEDU, is pharmacist and fellow, Ghana Center for Democratic Development, CDD Ghana. Gentlemen joining us via Zoom, good morning and thank you for your time.
Good morning, Samson.
Good morning.
Right. So let's start.
Good morning, Samson.
Great, Kwame. Let's start with Kwame and Dr. Bayo very briefly on the COVID-19 situation. Now, Dr. Bayo, your association issued a statement and you said that the COVID-19 case counts in the country has sharply increased. You blame it on things including importation of cases from other countries via travelers arriving at the points of entry. And you say that the situation in the country is alarming and dire at this particular moment. The risk of potential exponential rise in the number of cases cannot be discounted. What's the basis for this, Dr. Bayo?
Good morning, Samson. Thank you for having me. Good morning to the honorable panelists in studio and then to our listeners. I think the basis for this is the rising trend we have seen from the data published by the Ghana Health Service and our independent information we are collating from our members across the regions. Over the past few weeks, most of our ICUs have been full. And our treatment centers are stretched to capacity. And unfortunately, it doesn't look like we are taking it as seriously as we did in the initial stages. And that is why we are sounding this alarm. And that is basically what it is.
Treatment centers stretched to capacity. What does that mean?
Well, so if you look at currently in the before November, around somewhere October, most of our some of our isolation centers were closed because there was virtually nobody there. If you take a place like UGMC, which was a treatment center, their treatment center was no longer having any COVID patients. Their ICU was not having COVID patients. And so doctors and other health workers who had been relocated there from other facilities were returned back to base. Ghana East had very few number of patients. And the doctors who had been called there from Kolebu and other facilities were returned back to base. Now, in the past few days, we've had, especially the ICUs, being filled up. Personally, I've had families call me that I tried to get them into admission, and I had to call a few centers, call a few people to be able to get them in. And this is what we are talking about. If you go to Ghana East, the number on admission has gone up. The explanation there is partly what we have stated in our statement. There's a change in government policy that now says that all those coming in that test positive must be sent to a treatment center for at least 7 days. This immediately shot up the numbers at Ghana East. And when you come to the ICU itself, I don't know the figure they have as of now, but during that weekend when we were preparing this statement, the figures we were getting was that the numbers were increasing across the country. If you go to Konfanoche, the number of admissions they had in the first 2 weeks of January alone surpassed what they had in November and in December and even part of October together. So this is the data that backs what we have said.
Now, Kwame, earlier I called Dr. Bayo about an entire family that is affected and was stranded, what to do. But that was because we had a testing regime going on and they had tested. Presently, we are not testing, are we?
To say we are not testing would not be entirely accurate. We are testing, but how are we testing is what I would allude to. And why do I say that? If you look at our tests, composite testing, you'd realize that over 65% of all our tests are taking place at Kotoka International Airport. And then there is another between 12 and 15% that is taking place because certain people are either traveling out of the country and therefore require tests. Like now, you require tests to come to the United Kingdom, you require tests to go to Canada, you require tests to go to Dubai, you require tests to go to China. So people are testing to leave the country. And in that segment as well are the oil rigs and mines where they need to mandatory test because they don't want to infect their workforce and have to shut down. So at the end of that, you are left with about just over 10% of the total tests that are happening in country. And that is what I'd want to concentrate on. So when you disaggregate the tests that way, you realize that our positivity in country has gone up considerably in the last 2 weeks. And I think that agrees with what Dr. Bayo is saying, because more people are testing positive when they've gone to health facilities. And as a result, doctors are suspecting that they have COVID and are sampling and sending them for tests. That then, as I've said previously, also correlates with the generation, the community, and the extent. So the point is, we need another strategy to try as much as possible to be able to capture the level of infection in the general population, because it's that level of infection in the general population that is leading to you having to call Dr. Bayo. That's leading to things like Dr. Bayo is saying that families are calling him about what to do. And if you go on social media, it doesn't take rocket science to see that there are a lot of people with symptoms which you'd say fit the classic case definition, but are trying to manage it themselves. So this is where we are. And it doesn't all go well, because I'd want to be blunt in the sense that if you are listening anecdotally or you've got friends, you'd realize that the mortalities that are happening now may not be a lot, but they are very influential people. We are losing human resources that we cannot afford to replace almost immediately. As a country, we are not that endowed with human resources. And yesterday, I made a post on social media and I said, it's interesting because when you look at the 341 reported cases now of mortality, at least when I count from the primary school I went to, University Primary, I count the secondary school I went to at Adesado College, I count the university I went to, University of Science and Technology, my colleague pharmacists who've lost their lives, my colleague doctors who've lost their lives, my colleague nurses who've lost their lives. I know over 30 of them. These are health human resource, other professional human resource that the country doesn't have an abundance of. The question we should ask ourselves is, are we prepared to take the hit on our human resource, and to what cost?
Kwame, whether we were testing was because we knew initially that there was a certain regime of testing consistent being pursued by government. Is that still going on? Or we are in a state where if you feel you want to test, then you go and get tested and pay to test. And the Ghana Medical Association, you are saying the test must now be free.
Yes, Samson, that you are right. And that was why I tried to disaggregate the test. In fact, so you'd say that about 80, 90% of all tests are paid for in Ghana now. It's only the ones who go to health facilities and are suspected of having COVID that are getting it free. that is also affecting the number of people, I believe, who are availing themselves to testing. Because if you have to pay anything between 300 and 1,000 Ghana cedis to get a test, and you have symptomatic reason to suspect that you have COVID, and you have a doctor friend, a nurse friend, a pharmacist friend, most people, if you look on social media, are contacting them and they are telling them what to do. So they are not testing. And in effect, such people are also spreading the disease because they are not isolating. And that is the problem we find ourselves in, that because we are not testing, people are also not isolating. And because they are not isolating, they are spreading more than they ordinarily would do. And these are some of the things that we need to take cognizance of at this point in time.
Dr. Bayo, you say as the GMA that the testing must now be free. Is that possible? And how will that impact on the current situation?
All right, Samson, thank you. I just concur to what Kwame has said. And why we are asking for the testing to be free is that, or heavily subsidized, that's what we said, either free or very subsidized, and so that it can be affordable, is because apart from people who come to hospital for other reasons or who are sick, that we refer them for testing. If you, Samson, or somebody else in their home right now have all the symptoms as we have so educated them in the media, they cannot smell, they don't have a taste, they are coughing and all of that, and they feel they may have COVID, and they want to get tested, there's no avenue unless the person comes to the hospital and then the person is referred to the system as a suspected case of COVID and then it's tested. Now, if the person goes for a private testing, this is very, very expensive. Apart from being expensive, it is a danger to us because those who test privately appear not to be linked to the system of care. And I'm using my words carefully here. Appear not to be linked to the system of care. Now, when you speak to the Ghana Health Service, they'll give you a beautiful picture that says that if you test in a private lab, your data is uploaded onto a software, which all the labs at the time of identity were hooked onto. So that is true. When people test positive in these private labs, nobody contacts them. If they have their data, why are they left to go around calling doctors, calling family, calling people to find out where they can go? I have had in the past few days, several families come to me with positive test results. Some call me and tell me, we've tested positive from this facility. Where do we go? So you realize that apart from the cost as it is now, those who test by this means are not helping the system because they test, they are handed their results, and there's no further linkages. Okay. What do they do with the results? In that meantime, they are spreading this infection to family, to friends, as they are moving from place to place to see what they can do.
My final question to you, final question to you, Dr. Bayo, is at this time, when the GMA says the count is rising, and that is a fact, and that the situation is worsening and is dire, schools are resuming en bloc, including kids having to go back to school. Tell us, how do we navigate the dangers?
Well, so I think we commented on that in our statement. We acknowledge the fact that our schools cannot be perpetually closed. And if you look at the fact that the current figures and data that we have to strike a balance. It is necessary for our children to go to school because even at home, they are still within the same community. And their risk is also there. Now, in a school, we are suggesting that the beautifully designed linkages that have been created by the Ghana Health Service should be made to work. Schools have been mapped to health facilities. This should be practical and not on paper. Teachers should be trained on how to pick up early signs in students or pupils so that they can be isolated and treated and linked to the healthcare system quickly to prevent mass spread. Emergency lines should be given dedicated to schools so that when they pick up cases, they know they can call this hospital or call this facility and they'll be attended to. It shouldn't be what is happening in the general population now, where we have a 113 that you can call and call and call and you are not getting any feedback, or you don't know what to do and you have to end up looking for tests to call. That should not be the norm as far as the schools are concerned. And then the teachers must teach the students to use their sanitizers, wash their hands frequently, and then use a face mask. Parents must also play a role, take personal responsibility in ensuring that their children get these PPEs as they go to school. We need to manage the situation somehow, but of utmost importance is a practical linkage system and not one on only paper.
Thank you very much, Dr. Bayo. And Kwame Sapong-Asiedu, how do we go about this? Dr. Matthew Poku Prempe, I remember how he put it. When you move, the virus moves. When you stop, it stops. The president also said, that was one of his very first addresses, that moving from our doorstep, that's when it begins. How do we go to school, everybody go to school, and avoid the spread?
Thanks, Samson. The thing about schooling is that, like Dr. Bayo said, we cannot perpetually lock our children. I have always insisted that with a virus where it's a matter of hygiene, our risk communication should be paramount so that people pick up the right behaviors. I am less concerned about the reopening of schools than I am of the behaviors that are non-existent. Because if these kids were going to school and they were going to socially distance, if they could, wear their face masks, wash their hands, especially when the case mortality amongst the below 20 years is quite low, though they can still spread the disease, I would struggle to see why the children should continually stay at home. But where we find ourselves in a situation whereby the behaviors are non-existent, people are not socially distancing, people are not washing their hands, people are not wearing their face masks. I mean, it is the exception rather than the norm to see some of these behaviors in the general population. You ask yourself, even if with the best will in the world, the teachers are able to enforce these things in school, bear in mind that these teachers as well are members of the general population who perhaps are part of the people who do not comply with these regulations. So you are creating an artificial environment of compliance in the schools. The problem then becomes when these children and the teachers leave the schools to go to their dwellings, they are mixing with the general population during the commute and all that. They can pick up infection along the line in the trottoirs, on their walks and all that, or even when they go and play football in the park. That would lead to spread. So we need to have an honest conversation with ourselves around the value chain of educational commuting and behaviors and see whether we are at a place where these children can behave in a manner that would keep us all safe. That should be part of this whole opening up conversation. If we continue, like Dr. Bayo said, doing the paper exercise of saying we've done this in the schools, we've done that in the schools, we've done that in the schools, and therefore schools are safe, we would be creating a niche that would come back and bite us, because that niche would be atypical of the general population. And like it said, water finds its own level. The virus would move if the population moves. So to prevent it from moving with the population, we've got to behave properly. Otherwise, the next best thing is what we call artificial herd immunity, locking the whole country down and getting everybody vaccinated. We are not at that point yet. We don't have that luxury of doing that. So the only option left to us, Samson, if you ask me, is if the schools have to continue to be open, then the risk communication of the risks we face, of the reality that the kids can go to school, come and infect their parents and become orphans. Some of these communications should become part of our lingua and our communication. We should move away from the softly approach, and there should be enforcement as well. Right. That is how I would leave it.
Thank you very much, Kwame Siedu Sapong, also joining us from the UK with his thoughts on these matters. When the schools were partially opened for a stream of the JHS students to return, I'm responsible for one. I couldn't think about letting her go, so she didn't go for the first term. Then later, once I assured myself that things were good, I allowed. Now I'm supposed to allow my kids to go back, and I can't think about that. So I think that a lot more needs to be done to assure some of us that it is safe to let our kids go back to school. Thank you very much. Now, let's come to look at the questions of the developments in Parliament. But since we have our members of Parliament, leader, and his friend here, let's take their thoughts very briefly on COVID-19 situation and reopening of the schools. So Chairman Sebonsu, what are your thoughts?
Well, I agree with the sentiments expressed. We must admit that cases are shooting up. We all do know. They mentioned the fact of the importation of the disease in Ghana. I think we must also admit that various actions have also contributed, even locally, to this. We had elections, we had mini rallies. In my own case, let me admit that in most of the mini rallies that I organized, and the mini rallies were confined to electoral areas. Each electoral area had 2 mini rallies, so the crowd was not sizable. I tried on most of the occasions to provide chairs, which are socially distanced. But then when the seats that were provided were taken up, people who flocked later on to the place would not observe the social distancing protocols. You talk to them, but they'll say that, well, I remember one of them shot back that, and another person said, so it's ineffectual, right, as far as we are concerned. Yeah. They have grave consequences. They will simply not obey, thinking that because the numbers were dwindling, we were safe. But we're not safe. So I think that we need to be proactive, the children going to school, the issues about proactivity and letting the children observe the social distancing, the teachers themselves being given proper orientation to make early detection of the cases, schools being linked up to the various facilities for testing, if any, so that we minimize the risk. I think that all of us should be careful because the sickness is still here with us. Right. And until we have the vaccination, we are not sure of our circumstances, even with the vaccination. Nobody now can even tell the period that it may provide immunity. So is it going to be 6 months? Is it going to be 1 year? We're not too sure. So I think we need to be careful as a country and perhaps reactivate the processes that we initiated and even more. Right. Beyond that, given the fact that the numbers are shooting up.
Right. Mr. Ayaga, and as he mentioned, campaigning issues, the GMA also talks about the Christmas festivities, New Year festivities. We let our guards down, and now they are saying that they entreat all Ghanaians to take their personal safety into their hands by adhering strictly to all the COVID-19 safety protocols.
Well, I mean, I would not like to belabor the points that have been mentioned by Honorable Leader, because during our campaigning, we all breached extensively the COVID protocols to conduct our campaigning and electioneering. And in the process, we deepened a certain perception in the public that COVID wasn't really a threat. And already many people didn't believe that COVID was a threat. and by our conduct, we deepen that perception. And then the Christmas festivities, and then also the reality that many people come into the country from mainly Europe and America during the Christmas and the New Year to spend time with their family during the vacation and go back. And those countries have high cases of COVID infections, and the chances that
some countries are actually beginning to ban travelers from those
from those countries.
Places.
Yes, and so that was I think one of the reasons that can account for the spikes. There's generally a consensus that it's come and we have to get our schools running. Parents don't seem this time to be in disagreement with the idea of reopening schools, even though some parents still have apprehensions. I mean, all of us have apprehensions, but the reality is that schools have to reopen one way or the other. The question then is whether the systems we are putting in place will be adequate, and if the general population will support the implementation of those systems to minimize the risk to the children and through the children to parents, because the threat to children from all the signs is very minimal. But the threat of children infecting the elderly is what is really the major challenge. And so we all need to support the process. But I always use this opportunity to raise a certain point, which is the closure of the land borders. And as an MP representing a border constituency, I have always felt that the decision to reopen the airports and yet close the land borders is in a sense discriminatory. And the threats are coming more from Europe and America than from our colleague West African countries. And so if we find it okay to open the airport and put in place measures there, let's equally open the land borders and see what measures we can equally put there to minimize the threats. Otherwise, the continued closure of the land borders really threaten the economy of many of these border constituencies. And if we don't die from COVID, we will die of poverty. I mean, that's the reality that many of us face.
All right.
And so I urge the president to consider reopening also the land borders and rather work with all of us to put in place mechanisms there to minimize the threat from neighboring countries.
Right. We take a quick break, return to Parliament. We'll be right back.